Hi, this is my first video, so please forgive me for the the stutters, and this is actually my third or fourth time to try to make this video. Who knew it was so difficult? How self-conscious you are. But I wanted to make some videos after much thought about it because I haven't ran across any videos that seem similar to my situation where somebody had the weight loss surgery because they were very ill, and I'm pretty sick. In fact, today's not a very good day. The hair is mussed up, and even at 47, you still get zits, and don't have any makeup on. If I make any more videos, this will probably be my regular uniform, some type of t-shirt, probably usually gray, and I wear lounge pants because that's what's comfortable to me. I'm 47 years old. I never married or had children. I had a 16-year nursing career that I loved. The last 8 years of that was on an oncology floor giving chemotherapy to cancer patients, and I had to give that career up in 2011 due to illness, and I grieved that career heavily. I loved the relationship I had with my cancer patients, and my health is just a train wreck. In fact, my primary care physician says that, you look pretty good, but on paper you're a train wreck, and he's right. I try not to wallow in it. I'm not one of these people who beg for sympathy. I don't want sympathy. But I just try to make the best of every day and do the best that I can. And I know that there are certainly people that have worse situations than I do. But I am looking at having the vertical sleeve gastrectomy on December the 16th. And they will be removing my lap band and going to a sleeve during that same procedure. It'll be one procedure versus two. And the reasoning for that is strictly because of my health. I'm a diabetic. My diabetes is totally out of control. My blood sugars are horrible. I was on an insulin pump for 5 years, and when I went on Medicare, because of the disability, they will not pay for the tubing, so I had to go back to 5 shots a day, and it's not adequate. My body needed that continuous insulin from that pump to keep my blood sugars regulated, and having to go to shots to try to chase the blood sugars has been a dismal effort. In addition to that, it's not about what I put in my mouth. Diabetics are made to feel really guilty about their disease, that there's a lot of shame associated with it because people associate diabetes with what you eat, and when you're overweight like I am, they certainly make that judgment without any facts. It's just an automatic judgment. Well, you're diabetic because you're fat. It's not the case. I actually have a form of diabetes that's called type 1.5 that a lot of people don't know about, and it's latent adult onset of diabetes due to autoimmune disease. I have rheumatoid arthritis, and rheumatoid arthritis is an autoimmune disease. It's not your grandma's old age arthritis. It's actually attacked many of my joints, the joints of my hands and my feet. My wrists are involved, my shoulders, the large joints of my shoulders and my hips. I'm in pain 24/7. My mobility is affected because I'm often stiff and achy, and I don't need to use any assistive devices right now. Occasionally I have used a cane when I was in what they call a flare, when I'm in a lot of pain and can't move very well, but that doesn't happen often. The rheumatoid arthritis is actually what ended my nursing career. I just couldn't walk the floors anymore because of the pain, and I couldn't lift or pull on patients anymore. And with the nature of all the joints involved, there's very little other work that I can do because of the pain and the lack of mobility. It was a terrible time in my life. I grieved heavily, losing the career. Weight loss surgery isn't new to me. I had a band placed in 2005, and I never hit the sweet spot on the fill. I don't know if you know much about bands, but you're always chasing the right fill amount for the right level of tightness of the band, so that you can eat but not overeat and achieve a measurable weight loss. My highest weight was 238 on the day of surgery. My weight was 215, and I only had a 20-pound weight loss, and I've gained it all back. Well, not all of it, but most of it. My current weight is 212, so you can see that over a decade that I'm right around my surgical weight. It's not satisfactory. I have multiple specialists, and they all agree. My diabetes doctor, my endocrinologist, says that he feels like having the lap band removed so that I can eat more healthily is great. He thinks that the restriction that the sleeve will offer will be consistent, and that I'll drop off some weight, and that perhaps dropping off the weight will lower the amounts of insulin that I need to take. He does not believe that I'll be insulin free. Currently, if you know anything about insulin, I'm taking a long-acting insulin called Levemir, 80 units twice a day, and then I take a fast-acting insulin of Novolog with meals at 20 to 30 units per meal, which is literally enough to kill somebody. I rarely in my nursing career did I administer that much insulin to somebody. They were usually on an insulin pump. And so there's the rub. Medicare won't pay for the tubing, so I've had to go back to the shots. They're ineffective. And then I have the inflammation and the pain from the rheumatoid arthritis, which drives up blood sugar. In addition to affecting my joints, the rheumatoid arthritis has also caused problems with my heart. It narrowed the vessels in my heart due to inflammation and caused plaque accumulation. So in March I had a 99% and a 75% blockage that had to be corrected with stents. And I've been doing well. I actually tried to schedule this vertical sleeve gastrectomy on September the 2nd, and it was canceled because my cardiologist did not think that I was far enough out from my stents to alter my to hold my medication for surgery. But I saw him 2 weeks ago, and he gave me the go-ahead, and we're going to change up some of my medication for surgery, hold my oral medication, and go on the Levinox injections for blood thinning purposes so that I don't clot off. And my surgeon is good with all of that. So I have a surgeon, a rheumatologist, a gastroenterologist, and cardiologist, and several others that agree that this would be the best step for me health-wise, because if we don't do something, I'm going to end up in a dialysis chair, or I'm going to have open heart surgery, or I could actually die in my sleep from diabetes, from my blood sugar rising too high. So, you know, I don't want any of those things to happen. I want to try to stay as healthy as I can because, again, I'm 47 and I'm single. I live alone, and I want to be as independent as long as I possibly can. So that's kind of where we are right now. I just wanted to give you an introduction and kind of what's going on. I don't want this video to get too long because it will shut off, and I want to upload it, so I'll do a part 2 later. And forgive me for the appearance. Today's a pain day. If I do make more videos, this is typically what you're going to see. Mussed up hair, no makeup, zits, and probably a gray t-shirt or another t-shirt because I live in t-shirts and lounge pants. So that's me. And I also realize I have a horrible Oklahoma accent, so bear with me. I hope that my videos will help somebody else. I know that certainly your videos have meant a lot. I'd like to give a shout out to Molly Sleeved and Less of Sarah. I learned a lot from your videos, and I appreciate the time and effort that you've taken in making those, because they do make a difference to people who are in the same weight loss journey. So thank you guys, and I'm right at a little over 9 minutes, so I'll see you in the next video.